I'm Nora Bachman, a pediatric physical therapist. I want to discuss total motion release, or TMR, a technique developed by Tom Delonzo Baker and modified by Susan Bloom for pediatrics. So generally, TMR describes a restriction in our motion that is limited due to a tightness or a stickiness of our fascia. You may have heard of fascia. It's a very thin layer that covers all of the structures within our body. It's made up of what's called a cellular matrix. And basically, if you're injured, you may have a limitation on the motion within your fascia because the cells, after being injured, aren't lining up the way they should be. So typically it's an organized fashion, but after an injury, they may lay down haphazardly and get kind of stuck together. So you might see this if you have a scar. They'll often recommend doing scar massage to try and get that motion back, say just in your skin. You can also see it with a diagnosis called torticollis in a baby generally. The main type typically refers to tightness in this muscle, the SCM, where if my right-sided muscle were tight, I might be limited in bending to the other side, my left, or rotating to my right. That might limit my motion. Now, torticollis doesn't always present this way. In fact, when I'm using TMR, I'm usually not even messing with the neck that much. But based on this theory of fascia getting stuck in one position, where maybe the fascia from one structure gets stuck to the fascia next to it, we can do a simple, pain-free release to achieve more motion, which can then allow us to perform the activities that have been restricted prior to this. So essentially what TMR looks at is a systematic approach, and the TMR Tots and Teens version, the pediatrics version, has 11 motions that we might look at. So this can actually be pretty easily taught to caregivers through telehealth. And essentially what we're doing is determining, is there a big difference in motion looking at one side versus the other? So we'll use the TMR treatment when there's an asymmetry. So for example, maybe I can move super far to my right, but I can't really move to my left. With kids, we'll often use terms like yummy or yucky. And sometimes with babies particularly, we're going to be looking at their faces to see what's their reaction. Do they prefer one motion versus another? Oftentimes people will ask, but how did my child end up with this restriction? They were just born, or they're only a few months old. And sometimes we don't know. Often it just has to do with their positioning in utero. That's obviously very squishy in there, and perhaps there's just not a lot of room for movement, or the baby just didn't move a ton while they were in utero. Sometimes with twins, we will often see those limitations just because there's less space. It can also happen during the birthing process. Obviously, there's a lot that goes on there, and sometimes, as I said, you just don't know. But the important thing is that with TMR, we can still treat it, and you can still have great benefits, even if we don't know why.